Is this the only heart that's over there?
Yeah.
Yes. Was the last one.
All right, well, fortunately. Okay. This is what's left of the superior vena cava. Okay, now, what we're going to do is, the superior vena cava empties into what?
To the atrium.
The right atrium. Okay? So you're going to, the probe's in the right atrium right now.
Yeah.
I'm going to leave it there. So just take the scissor and make a cut along the probe until you can stick your finger in here. You're going to feel a pocket open up. That's the right atrium. Got that?
Got it.
So all you have to do is take a scissor like this, stick it right in here, and cut along this probe.
All right.
And when you get far enough, you'll be able to stick your finger right in the right atrium.
All right.
All right, you can feel it give way here as I go in.
Okay.
All right, that's number one. Okay, number two, you have to look for the pulmonary trunk. Here's the pulmonary trunk. Here's the pulmonary trunk up here. See it?
All right. This one, right?
Yeah, see this
Okay.
one right here? I'm going to mark it like that. Now this gives you entrance into the right heart. Here's the interventricular septum. And you want to stay away from this with the scalpel. So you're going to make a cut across here, and then you're going to come down like this. Here's the interventricular septum. You want to come down like this and then angle away from it so you stay parallel to it. Do you understand?
All right.
Use these two borders as an anatomical marker, and you want to be right in the middle there. When you open that up, you'll be in the right ventricle. If you want to prove that, go back to the right atrium, stick the probe in the right atrium, it'll come right through the tricuspid valve and into the right ventricle. Okay, now over here, this is the easy one. This is the left auricle of the left ventricle. You'll make a cut straight down through this, right from the base of the heart all the way to the apex, staying away from this. When you do that, now this is where the heart muscle is thickest, so you're going to have to go through this a few times to get through it. Once you get through it, you'll be able to open this up like a book. When you open it up, you'll see the left atrium, you'll see the bicuspid valve, you'll see papillary muscles, the chordae tendineae, and you'll see the very muscular left ventricle. And then I'll show you how to find the aorta. We'll cut through the aorta and we'll try to find the aortic semilunar valve.
All right.
Got it.
Okay? Any questions about that?
No, Professor.
Like I said, this is not in the best shape, but
So we start here.
this is the entrance. Now, I just drove down here and I can feel the tip of the probe right here. That's in the right atrium. So you want to cut along that and open it up. Okay?
Okay.
You see that everybody pictures this as the heart is like that. It's not. The right atrium's all the way back here. The right ventricle is here. This is the right heart. This is the left heart.
All right.